The summer of public sector discontent continues, with railway workers walking off the job, junior doctors and consultants set to strike together for the first time. But members of the British Medical Association will stage industrial action this month and next in the disputes over government pay deals. Now, the NHS says it will be an unprecedented challenge for the health service. I think the people that are being forgotten in all of this is actually the patients. But whilst those might have a right to strike, it is good old Joe Public, isn't it, that we'll have to find another way to get to work, or in this case as well, to get care, get treatment. Am I right in asking, do we think? Is it right to strike? We've got a range of views on this now. Let's speak now to Barrister and Former Nurse, Butler. We've got human rights campaigner Fraser Maclean and trade unionist Rob Williams. Great stuff, a full panel here. And I will start with you, Rebecca. So, Barrister, Former Nurse, are they right to strike, the junior doctors and the consultants, at the same time?
No, I don't think they are. And I think they've lost the public sympathy as well, because we are struggling with increasing waiting lists following the pandemic and following the lockdowns during the pandemic. And the NHS just cannot afford for people to lose their elective surgery slots. Sometimes people wait 3 to 5 years for life-changing orthopaedic surgery, for example, and to be told that their elective surgery is going to be cancelled must be absolutely devastating for them. I think that doctors have really got to remember that first do no harm is what they're required to do. That's what we pay them to do, and I'm afraid they are harming people. Of course they have a right to strike, Patrick. Nobody's saying they don't, but their demands are so unreasonable that, we are facing militant action for a very, very long time.
All right, Fraser, I can see you shaking your head there, especially about the idea that their demands are being unreasonable. £130,000 a year, would you go on strike for that?
Well, the junior doctors don't want £130,000 a year, but I mean, it's a nasty debate because it villainises a very, very important part of civil society. I think the points about backlogs and poor service are very, very relevant, but the strike is happening as a consequence of the same causes. How many more deaths will there be if all the junior doctors head off to Australia, where they can work for a few hours and earn double the money? And keep in mind, they're not asking for an 100% increase; they're asking for a third of that. It'd be about
Are they not asking for a healthcare system though that activists in this country would ban us from having a partly private, partly public healthcare system? I mean, that's one of the reasons, Fraser, isn't it? Why in Australia they can do that?
No, Patrick. This wage is not some sort of illegitimate, outstanding demand. There was £37 billion spent on test and trace. If you want to know why the government have gone to war with the doctors but have money for other things, including the triple lock, Google the average age of a Tory voter. Why aren't the NHS wages subject to a triple lock?
Okay,
I have to ask a question here, Patrick, if I may.
All right.
Fraser, you are talking to somebody who did go to Australia with a junior doctor, when we were significantly younger. And yes, the wage rates are higher there. But as Patrick has quite rightly said, the system is part insurance funded. The issue here is, why are junior doctors and now consultants going on strike for conditions that are far better than any other sector? I've done my research this afternoon. Do you realise, Fraser, that the NHS pays no, you're shaking your head. I haven't even said what I've got to say. The NHS pays employers' contributions for NI at over 28%, compared with the private sector where employers pay 8%.
All right. I get what you mean. So you're saying that I get about the pensions. I'm going to throw it over to Rob. Rob, timing this perfectly in line with Conservative Party conference. This is political. It's not about patients, Rob, is it?
It's absolutely about patients, because I think, as the last but one contributor said, doctors are fighting for the NHS, for patients, against the backlogs. Let's be clear, these are taking action, but they're not responsible for the waiting list. They're not responsible for the backlogs. Patrick, when you talk about militants, let's be clear, this is only the second time in about 4 decades that junior doctors have taken action. Consultants, some of these will probably regard themselves as, some of them, Tory voters in the past. We've had in the last year the RCN union, for the first time in its history, taking action. I tell you what, these are workers who've had an absolute gutsful, are taking action. The government shouldn't worry about their conference. They should get to the negotiating table today to resolve this dispute. These are workers who should support their
go on.
Negotiating table. The BMA refused to negotiate. They released into the public documents that were confidential, and they were communicating with each other by WhatsApp during the meeting rather than actually negotiating. They made a complete fool of themselves during negotiations. You need to read up about what the BMA is doing to the profession. It is an utter disgrace the way the BMA is behaving.
Okay, Fraser, on average, if we're having a look at the amount of money that gets pumped into our public sector as opposed to our private sector, on average, the wages in the public sector are higher than the average in the private sector. Why should our junior doctors and our consultants be getting another bumper pay rise? I'm looking at it here now. The pay for junior doctors will be increased by an average of around 8.8%. That was what was published on the 13th of July this year. That's enough, isn't it?
Well, in terms of overall money sloshing around, I don't think there'll be an actual comparison. It depends on how you look at the data. The point is, if you're talking about junior doctors, you're talking about people working 50-hour weeks. You're talking about people who have to pay for their own training, pay for their own exams. You're talking about people who give up their weekends, who give up their nights every 6 weeks, who get no overtime bonuses. Now, all these things aren't expected in the private sector, so I don't know why we're comparing the two. The fact is, for a relatively small amount of government money, this dispute could be over and conference could go ahead as scheduled.
I will go to you, Rob, before I go for the final word from Rebecca. Yeah, I mean, look, is this not just militancy and people will die as a result? This is the thing. It's one thing when train drivers go on strike. It's another thing if a consultant on 130 grand a year decides to go on strike and somebody dies as a result. We had 120,000 people revealed to have died in the last year waiting for NHS treatment.
Yeah, but those people, unfortunately and tragically, died because the NHS is in a disastrous situation, and it's because these junior doctors and the consultants and nurses and all the other health professionals are keeping the NHS going. Look, some of these junior doctors have got student debts of up to £80,000. This government took away nurses' bursaries. We've got consultants here that are not on £130,000 a year. These are workers fighting for the NHS, and we should support them.
I mean, there is an argument, of course, isn't there, that a lot of the people who will be dying will be on a lot less money than a lot of the people with a lot worse pensions than those who are going on strike as well, because otherwise maybe they would afford to go private. But, Rebecca, I'll give the final word to you on this. You just heard what those two chaps have had to say. Anything to come back on?
Well, yes, I have. First of all, student debt is not a loan. It's actually a tax, and it's a tax on earnings. And it is quite right that people who have high-paid jobs should pay back the education that they get given in order to have the high-paid job. So that's my first point. My second point is, Fraser, doctors are not a special case. You're talking to a barrister. I work every single weekend. I work every single evening. I work every single day. You do not work more hours than I do. And trust me, I live in a medical family, and they are aghast at how many hours I put in. You are not a special case because you are a doctor.